Hi everybody, Dr. Michelle here, and what we're going to do today are front planks and side planks. These are really great ways in order to strengthen your core musculature, and it's great because it doesn't actually put your spine into flexion or extension. We're keeping it nice and neutral, which is what we want to do on a regular everyday basis. So these are very functional rehab exercises for you. So the first one we're going to talk about is the front plank. There's a couple different variations of this, and the one I'm going to talk to you today is with your arms extended. The reason is it gives you between your shoulder blades a little bit more activation of those muscles as well as into the lower core musculature. So I'm just going to talk about that to start with on your knees. So there's different progressions. You can start on your knees, you can go to your toes, you can go to 1 foot, but we're going to start with the beginning progression, which is on your knees. So Dr. Jen here is going to be our lovely model. So we're going to have her hands nice and straight out in front of her. The key with this is making sure they're right underneath her shoulders. So we'll have you move them back a little bit. Perfect. And then your chest is going to come right over. The other thing you want to make sure is you're pushing through here. So you got to push your chest up. So you want to stretch this out a little bit more. Nope, the opposite way. There you go. You want to make sure this is nice and flat. Then the other thing is you're going to be right onto this front part of the muscles, making sure you're not on the knee because that will be a little bit uncomfortable. Then you're going to pull your feet up just to give you a little bit more of your body weight. And we're going to tuck our bum down just a little bit. During this, these muscles in here are what we're going to be actively contracting. When I say actively contracting, a good way to actively contract it would be thinking as if you had to go pee and you were trying to stop that flow. That's going to get those very deep internal transverse abdominis, and then as well actively getting the upper obliques and abdominals. So when you get into this position, you're going to try to hold it for as long as you can. Ideally, if you can hold this position, making sure you push up here and making sure you're working between the shoulder blades, you should be able to hold this position from 30 seconds to a minute. If you're able to hold it for a minute, then that's when you're able to push up do it on your toes, which will be in the next video.